Does penis size really matter? This is one of the most common questions men ask, but at the same time, it is one of the topics that people feel the most uncomfortable talking about. Size. Almost every man has wondered about this at some point in his life. Am I average? Am I smaller than normal? Do women actually care about penis size? Does a bigger penis really mean better sex? And perhaps the most important question of all, should someone consider penis enlargement if they feel insecure about their size? Curious. These questions are incredibly common, but the problem is that most of the information available online is either exaggerated, misleading, or simply wrong. Many men develop anxiety about penis size based on unrealistic expectations created by pornography, social media, or myths that have been repeated for generations. But when we look at the actual scientific data, the reality is often very different from what people imagine. In fact, most men who believe they have a small penis are actually within the normal average range. And many men who believe that penis size determines sexual satisfaction are misunderstanding how sexual pleasure really works. Today, we are going to analyze this topic from a medical and scientific perspective. We will look at the real data about average penis size. We will talk about the psychological factors involved in male body image. We will discuss whether penis size truly influences sexual satisfaction, and we will also talk about when someone might consider medical treatments or surgery. Because the reality is nuanced. Penis size does not matter in the way many people think, but at the same time, perception, confidence, and personal expectations do play a role. Before we go deeper into this topic, let me introduce myself. My name is Dr. César Noval. I am a plastic surgeon and the director of Clinica NF. I specialize in penile enlargement surgery and gender surgery. Our clinics are currently located in Spain, Mexico, and Miami, and we treat patients from many different countries around the world. Our main educational YouTube channel is our Spanish channel called Clinica NEF, where we have built a community of more than 100,000 subscribers. On that channel, we talk about male sexual health, penis anatomy, erections, sexual performance, and treatments related to male intimate surgery. Because many people from different countries began asking for this information in English, we decided to create this channel as well. Since my schedule does not allow me to record every single video again in English, we are using artificial intelligence to translate and recreate our educational content so it can reach a much larger international audience. The goal of this channel is simple: to provide clear, medically accurate information about male sexual health. Now let's go back to the main question: does penis size really matter? To answer this question properly, we first need to understand the actual data about penis size, because the perception that many men have about what is normal is often very far from reality. Several large scientific studies have measured penis size in thousands of men. One of the most well-known studies analyzed data from more than 15,000 men across multiple countries. The results were surprisingly consistent. The average erect penis length is approximately between 13 and 14 centimeters, which is about 5.1 to 5.5 inches. The average erect circumference is approximately 11 to 12 centimeters, or about 4.5 inches. This means that the vast majority of men fall within a relatively narrow range around this average. However, surveys show that many men believe the average penis size is much larger than it actually is. This misconception often comes from exposure to pornography. Actors in adult films are often selected specifically because they have larger than average anatomy. This creates a distorted perception of what is normal. When men compare themselves to these unrealistic standards, they may feel inadequate even when they are completely within the normal range. But sexual satisfaction is not determined only by penis size. In fact, multiple studies have asked women about what factors matter most during sexual relationships, and the results are quite interesting. Many women report that emotional connection, communication, attraction, and sexual confidence play a much larger role in satisfaction than anatomy alone. Technique, intimacy, and understanding a partner's preferences often matter more than size itself. Another important anatomical factor is that the most sensitive areas of the vagina are located in the first few centimeters near the entrance. This means that extreme penis length is not necessarily required to stimulate these areas effectively. Of course, anatomy varies between individuals, and personal preferences also exist, but the idea that sexual satisfaction depends primarily on penis size is a significant oversimplification. Now let's talk about psychology. One of the biggest issues related to penis size is not physical anatomy, but perception. Some men develop what is known as penile dysmorphophobia. This is a form of body dysmorphic concern where a person becomes excessively worried about a perceived physical flaw. In many cases, these men have a completely normal penis size, but their perception tells them otherwise. This anxiety can affect confidence, sexual performance, and self esteem. In extreme cases, it can even contribute to erectile dysfunction due to performance anxiety. Confidence plays an enormous role in sexual relationships. When someone feels confident in their body, they tend to perform better sexually and communicate more effectively with their partner. Now let's address the question of penis enlargement. Many men wonder whether they should consider increasing their penis size. There are several approaches that are commonly discussed. Some are myths, some are ineffective, and some are legitimate medical procedures. Many products advertised online promise dramatic penis enlargement through pills, creams, or supplements. However, there is currently no scientific evidence that these products permanently increase penis size. Vacuum pumps can temporarily increase blood flow and create an erection, but they do not permanently enlarge the penis. Traction devices have shown some moderate evidence of increasing length when used consistently for many months, but the results are typically limited. Surgical procedures are currently the only methods capable of producing significant and permanent changes. Penile enlargement surgery can involve techniques that increase visible length or girth. However, surgery is not something that every man needs. Most men who seek these procedures are motivated by personal perception rather than medical necessity, and that is an important distinction. For some patients, improving their anatomy can significantly increase confidence and satisfaction. But for others, the real issue is psychological rather than physical. This is why proper evaluation and consultation are essential. Understanding expectations, anatomy, and motivations is crucial before considering any intervention. Another factor that influences perceived penis size is body composition. Excess fat in the suprapubic region can partially cover the base of the penis. This can make the penis appear smaller even though the actual length has not changed. Weight loss can sometimes reveal additional visible length simply by reducing fat in that area. This is why metabolic health and body composition can influence perceived penis size. Lifestyle factors also affect sexual function. Exercise improves blood circulation. Healthy diet supports hormone balance. Sleep influences testosterone levels. Stress management improves sexual performance. All of these factors contribute to overall sexual health. So, when we ask whether penis size matters, the answer is more complex than a simple yes or no. From a purely anatomical perspective, most men fall within the normal range. From a sexual satisfaction perspective, many other factors are often more important. But from a psychological perspective, perception and confidence can still influence how someone feels about their body. The key is understanding the difference between perception and reality. Most men who worry about their size are already normal, and improving confidence, communication, and sexual health often produces better results than focusing exclusively on anatomy.
Understanding the science behind male anatomy helps remove unnecessary anxiety and allows men to approach sexual health with a more balanced perspective. If you are interested in learning more about male sexual health, erections, penis anatomy, and medical treatments explained by a doctor, make sure to subscribe to this channel. Because here we will continue exploring these topics with clear, evidence based medical information designed to help you better understand your body and improve your health.